It is a pleasure that you are with me again. I hope you and your pet are well. Today we will talk about the following. Dry eye syndrome in dogs. Let's start. Dry eye syndrome in dogs, also known as keratoconjunctivitis sicca, is decreased or inadequate tear production. Tears are important for the lubrication, comfort, and general health of a dog's eyes. Tears also contain antibacterial proteins, mucus, infection-fighting white blood cells, and other enzymes to help keep your eyes clean and free of debris, infection, and irritation. Two glands, the lacrimal gland and the third eyelid, are responsible for producing the aqueous layer of tears. In dogs with dry eye syndrome, these glands contribute little or nothing to tears. This usually results in dry but sticky, mucus-filled eyes. 1. Symptoms of dry eye syndrome in dogs. Dogs with dry eye syndrome may exhibit one or more of the following symptoms: red, inflamed, irritated and painful eyes. Redness and swelling of the conjunctiva or the tissues around the eye. Squinting and blinking frequently. Dryness on the surface of the cornea, the clear, dome-shaped outer part of the eye. Mucus-like discharge from the cornea, may be yellow or green if there is a secondary bacterial infection. Obvious defects and irregularities of the cornea, including increased vascularity, abnormal growth of blood vessels in the injured area, and pigmentation as the eye attempts to heal and protect itself. Possible visual impairment and blindness. 2. Causes of dry eye syndrome in dogs. The cause of dry eye syndrome in a dog can be due to one or more underlying conditions. Your veterinarian will be able to determine what may have caused your pet's diagnosis based on the dog's medical history and an exam. Some of the underlying causes may be due to the following conditions. Dysfunction of the immune system. Most cases of dry eye syndrome in dogs are caused by the immune system attacking and destroying the lacrimal gland and third eyelid. Unfortunately, vets don't know why this happens. Medicines. Certain medications can cause dry eye syndrome as a side effect, usually very soon after a dog begins taking these medications. This type of dry eye syndrome can be temporary and may go away once the medication is stopped. However, permanent damage can be caused and there is no way to predict which animals will get dry eye syndrome or how long it will last. Be sure to talk to your vet about the possible side effects of all medications. The genes. Congenital allochronia is a genetic form of dry eye syndrome and occurs in some breeds, most notably Yorkshire Terriers. This is usually noticeable in only one eye. Endocrine disorders. Some systemic diseases, such as hypothyroidism, diabetes, and Cushing's disease, tend to decrease tear production. Infectious diseases. Canine distemper virus, leishmaniasis, and chronic blepharoconjunctivitis can cause dry eye syndrome. Medical procedures. A common abnormality of dogs is a third eyelid gland prolapse, more commonly known as cherry eye. While not recommended, some surgeons remove the gland entirely, leading to a permanent decrease in tear production. Local radiation for tumors can also cause permanent damage to the lacrimal and third eyelid glands. Neurological problems. Loss of nerve function to the glands, commonly secondary to an ear infection, can slow or stop tear production. Traumatic injury. Dry eye syndrome can occur with damage to the glands after inflammation or severe injury, such as from injuries or car accidents. Also, anesthesia causes a temporary loss of tear production, as does the medication atropine. Once they are removed, tear production normally returns. Your veterinarian will determine the best treatment for your dog, depending on his diagnosis and his previous medical history. Develop your dog's hidden intelligence to eliminate misbehavior and create the well-behaved, obedient pet of your dreams. Hit the instant access button below now. Don't forget to subscribe to the channel, comment, and share the video. Thanks.